Our mission is very similar to what we had from the very beginning. It's a commitment from this organization to stay true to its community, to make sure that we're responsive, we're available and accessible, that we speak the languages that our patients speak, and that we're aware of the different cultures that are part of our community, and that our healthcare builds upon that.
Patients that we serve live on average 10 fewer years than members of communities that are resourced differently just a few miles away. Once one sees that data, it's impossible to unsee it. Whatever we do, it has to involve humility, it has to involve deep listening, and it has to involve engagement with our patients.
From the very beginning, La Clínica understood how important it was to have community health workers who were from the community be involved in the care model.
Most of the staff, they grew up in this community. That's their family. And so seeing my staff being able to treat their family, then the families come to trust us, and I love that element of it.
La Clínica took a bit of a leap of faith on our program to allow us to bring in community traditional healers and practitioners to share with our community their practice and their medicine, and use it in collaboration with the clinical staff and setting. All of these practices, all of these traditions, our language, our history, were things that were not created in a vacuum. Our ancestors knew that those were powerful tools for wellness and that were medicine in times of crisis.
Partnerships are very important to the work that we do. Mammography van is a clear example of that. What we find is that often that's the first time our women are getting access to that service. We are certain that that service has been life-changing. And the feedback we get from our patients is so overwhelmingly positive.
We know that chronic disease outcomes are so much better when people have food that is both healthy and culturally appropriate, which is why we have linkages not only to the Alameda County Food Bank and other food banks in the areas that we serve, but we also help identify patients, and then Go Bento delivers medically appropriate meals that are culturally resonant for our patients.
Diabetes is one of those, like many health conditions, a silent killer. People don't know that they have these chronic health conditions until it's almost too late. One of the grants that I helped participate in was a diabetes screening grant where patients came in for routine dental care, routine exams, and in the chair we were able to do a diabetes health screening. Those little things we can catch early, they might not seem like a big deal, but it really will change the trajectory of their health outcomes.
La Clínica and its future and how we prepare for it is highly contingent on workforce development. Creating those pipelines from the universities, from the community colleges, even from the high schools, is critical to how we grow in the future. I hope that you understand today how important your contributions are to our individual patients and the difference that you're making in their lives and in the lives of their families. We couldn't do this work without you. We just want to thank you for that, and we're so glad that you pick us to be part of your family.